Good afternoon and welcome to HealthSystemCIO.com's All-Stars panel, Optimize Your Assets Through a Portfolio Management Framework, a webinar tweet chat combo from HealthSystemCIO.com sponsored by Encore, a Quintiles company. Just a little bit of housekeeping before we get started. My name is Anthony Guerra. I'm the editor-in-chief of HealthSystemCIO.com and I will be your moderator today. Kate Gamble, our managing editor and director of social media, is hosting a tweet chat alongside our event. You can view it in the media viewer panel on the right-hand side of your screen. If you want to participate, you can do that in a separate browser or on your phone by using the hashtag HSCIOchat. We're also going to be doing polls today, a couple of polls, so keep your eye on the polling panel. I'll let you know when that opens. And we're also going to have Q&A. So you can send in a question at any time in the Q&A box. Leave the default set to all panelists, and we will take those later in the event. And you can see the URL for the deck, and there's a URL at the bottom of the slide, so plenty of chances to grab the deck for today. Just so you see how we're going to spend our time, we're going to go about 45 to 50 minutes. And first we're going to have our panel discussion with Chris Belmont, VP and CIO at University of Texas MD Anderson Cancer Center, Julie Morrison, VP of IS at MemorialCare Health System, and Doug Abel, Managing Director, Strategy and Planning with Encore. So without further delay, let's jump into our discussion. Chris, would you start us off by giving us an overview of MD Anderson?
Sure, I'd be glad to. MD Anderson is a dedicated cancer center located in Houston, Texas. It's kind of a unique situation because that's all we do is cancer, but we still have all the other services that go along with a traditional healthcare organization. It's just that our focus is purely on cancer. Largest cancer center in the United States, 13 of the last 14 years ranked #1 in cancer for U.S. News and World Report. Large footprint here in the medical center, but we also have relationships with other organizations outside of Houston, including Banner in Tempe, Arizona, Scripps. We're working on a program to get started with them, Jacksonville, Florida, and then around the world as well. Also Cooper, up in New Jersey. And we're doing some relationships around the world in Madrid and Turkey, Brazil, and so on. So our one of our goals is to sort of democratize healthcare. So how do you get the MD Anderson experience outside of Houston, Texas, just like many other organizations? We do a tremendous amount of research. I think more than 60% of the cancer drugs approved last year were on a trial that was initiated here at MD Anderson. So it's a quite complex organization, but we also have many of the challenges that other organizations are facing from an IT perspective.
Very good. Julie?
Hi. MemorialCare is a regional integrated health system in Orange County and LA counties. We have 5 acute care hospitals, a health plan, a number of owned medical practices, and outpatient care centers. We're among one of the top IDNs in the western U.S. and about $2 billion in revenues as a not-for-profit organization. We care for about a little over 1 million patients a year. And from an IT perspective, we were one of the first organizations to follow Kaiser in terms of implementing Epic, starting in 2004.
Wow.
So we continue to focus on that. Yeah.
2004, a long time ago, huh?
Mm-hmm. Yeah.
Very good. Doug, a little bit about Encore?
Sure. Thanks, Anthony. Encore Health Resources been in HIT consultancy since about 2009. I wouldn't say we're really headquartered any place in particular. It's a very virtual organization with our consultants spread across the country. Despite a relatively short life for Encore since 2009, as I said, most of our leadership and consultants have been in the industry for a fairly long time. We offer a full life cycle of HIT solutions, from advisory, solution, strategy, selection, financial planning, pop health, regulatory measures, things like that, to implementation services, including training and go-live support, and then application management services. As I said, a bit of long-term experience across our consultants. About 75% of them hold either a clinical or other advanced degree, and another 85% across the board have some healthcare operations experience. Within our solutions, we offer proprietary tools and methodology, and we tend to focus on how we use and can help our clients use healthcare IT to improve quality and cost in delivering patient care.
Very good. Thank you, Doug. All right, let's start off with you, Julie, on this question. HIT is shifting from an era of incentive-driven investment in EHRs to one characterized by a demand for value in the investments that were made. Where does your organization stand in terms of that shift, and are you seeing increased demand to deliver value from HIT?
Yeah, I think in the last few years, we've been seeing more and more demand for really recognizing value. I started here, I joined MemorialCare a little over 2 years ago, and have certainly seen a shift in the time that I've been here. I've really been focused on advancing our IT governance to make sure that operations has more input into what IT does and doesn't do. And really in the last year, our business here has put more rigor around ROI, or value-driven benefits for large projects, really to the point now where projects don't go forward unless there's operational accountability to reduce expenses where we're making significant capital investments. So there's been a huge shift to really looking at all of the demand and choosing the things that we do move forward with that have based on those that will drive value for the organization.
Very good. I think we'll talk more about governance later. Chris, you want to touch on the question, please?
Yeah, I think it's the same challenge that everyone has. Is how do you prevent IT, or healthcare IT in particular, from becoming that necessary evil must-have, and how do you continually show value for that? So the pressure is always on us, and it's not about just doing the EHR big project transformations, but it's flipping from that mode and providing the internal consulting, the transformational resources, and other value that comes from IT. We have either the blessing or the curse of seeing the institution all day, all the time, horizontally. So not just in one silo, for example, not just in the clinical space, but we also interact with the operational and labor and research and all the other areas. So I think our job is to elevate ourselves out of just being that IT. And in fact, one of the things we're doing here at MD Anderson is we're not considering ourselves the IT department. We're moving to the IS, so it's more service-driven, so that we can pivot and not just be seen as that technology player in the institution, but more of an institutional asset.
Doug, what are your thoughts on how the industry is moving from, doing what it's being told to do by the government? It's not too much you don't have to explain yourself there, right? You say, well, I did what we had to do, to now having to show value from some of those investments. You want to talk a little bit about your thoughts on how organizations can go about doing that?
Sure. Let me reiterate. I think we're definitely seeing a shift in the industry from, as the question says, incentive-driven investment. Most of the industry, and we're seeing it in the numbers, have made that decision, have made that journey, or are in the throes of completing that journey. Not a lot of decisions will remain in selecting a new EHR and making those large investments. And as a result, as both Julie and Chris pointed to, a lot of demand for IT to rethink who they are, post that EHR journey. I think it takes a couple of things. One is to recognize that as an IT leader, you've been entrusted with some very high cost, assets. And, when we think of it, we think of assets beyond just, the application portfolio that you may have. For many people, they invested huge amounts in workforce as well, increase their staff and the like. And then ultimately, obviously one of the key assets is the data that's being produced. And as Chris said, how do you turn that into a service to the rest of the organization? So, the belief is that you have to have a framework that allows you to constantly evaluate that set of assets and say to yourself, am I getting everything out of those assets that I should? Are there assets that are duplicative that I need to rationalize out of the portfolio? And, are the assets that we've spent all this money in creating the value that we expected, either operational value, satisfaction, network value, or the like. And it's really a demand for sustained review and decision-making about those assets, and continuing to invest on the ones that create the most value, and as I said, rationalizing those out that create little or no value.
Very good, very good. All right, let's go to our next question. Chris, let's start with you on this one. Have you been asked outside of the normal budgeting demands to reduce IT spending? If so, what areas will you focus your search for those savings?
Yeah, I guess the question would be back, who hasn't been asked to do that? I mean, it's a constant pressure we're under, but it's focused on the value. And I think it's, in our case, at least from my perspective, it's not all about reducing. It's about, I hate to use this term, but right-sizing, because I think there are some reduction in areas. Doug mentioned your portfolio. You should always look at your portfolio. We have about 1,700 applications that we support. I think that's possibly 2x larger than what we should have. So consolidating that portfolio, you always need to look at things, and one of the efforts we're going through right now is how do we consolidate those so-called shadow IT departments, because there's resources and activities and things happening out there that are probably better done as a central kind of governance process, as Julie mentioned. So, I think, looking at that, we also are turning around and making, as everybody is probably doing, making a lot of investments in the security space and in the big data space. So I think it's just this constantly watching where you turn the knobs as far as where you're making the investments, and how do you make the tough calls and stopping some of the things. So what things do we turn off? We use this example all the time, but we have 5 document imaging systems. That's probably too many. I'm not sure it's 1, but it's definitely not 5. So how do we make those tough calls and help the organization shift to be driving toward a much leaner portfolio?
And Chris, it's a little more complicated than just saying, let's get down to 1, make it happen.
Yeah, the easy thing is turning it off, right? It's flipping the switch. The hardest thing is getting somebody to let go of it once you turn it off. And so, yes, agreed.
Right. Julie, if you want to talk a little bit about that, reducing IT spending and how you're focusing that reduction.
Yeah, we're having the same payer mix challenges that organizations across the country are having, and we're always looking for ways to reduce our expenses. One of the things that we do, I think that's sort of hardwired from an IT perspective and across the organization, is we're a heavy adopter of Lean, which has helped a lot. So when we do IS projects, they generally have a Lean component. We have a Lean fellow involved, and we really look for ways to operationally drive efficiencies along with the IT solution. But we have specific initiatives around looking at the applications we're supporting, not just to reduce support dollars, but also to free up staff from support work to more higher value efforts. That's really probably the #1 driver for our application rationalization efforts. We're also looking at ways to reduce contract labor, and we have a heavy focus on optimizing what we have, which is really in the end we're going to spend money, but we're doing it in ways where we're spending money where we're going to drive savings or increase revenue. So looking at new tools to take advantage of that will drive efficiencies in order to meet our budget demands.
Very good. All right.
Just might be jumping in.
Well, Chris, why don't you jump in, then we'll go to you, Doug. Go ahead, Chris.
Okay.
Yeah, I think that lean approach is excellent. You know, once that becomes truly kind of intertwined in your culture, it makes the decision-making process a lot easier. So congratulations on getting there.
Doug?
Yeah, it was here long before I arrived, but it's been a really helpful tool.
Doug?
Sure. You know, in my role, I get to talk to a lot of CIOs across the country, and what has surprised me over the last year, Chris made the point that, you know, who isn't asked to reduce costs, and a lot of times that comes from just, you know, general budgetary pressures. What has surprised me is the number of organizations that have established a corporate goal in 2017 to reduce IT cost. So it's not an IT goal, it's not a general budget goal, it is a specific organizational goal directed at IT cost, and I think that's reflective of the time and era that we're shifting into.
You know, Doug, I agree with you, and I think one of the challenges as you can see from my bio, I'm old enough to have gone through a couple of these cycles. The unfortunate thing from IT is if you only look at it vertically and you say, let's cut IT expense, that may be a flawed approach when you have to tackle expenses at a regional level. Because how many times do you go into a meeting and the first thing out of someone's mouth is, we'll save a lot of money if we would just stand up this website, or we'll just build this database, or we'll just implement this new program. I think if we look at it holistically instead of, you know, sort of vertically, an investment, a 25-cent investment in IT that saves $1 in operations is still a good investment, but it doesn't do anything to my, you know, expense structure. So, you know, institutions that look at things more holistically versus at the individual division level will probably have a better success of providing value.
Yeah, I think you're absolutely right, Chris.
All right. All right, very good. We're going to go with our first poll question today. I'm going to open this up now, and then you can go ahead. This is a single select question. How will your IT capital investment change in 2017? Grow dramatically, more than 5%, grow somewhat, less than 5%, stay the same, shrink somewhat, or shrink dramatically. So if you want to go ahead, we'd really appreciate your input on that. Go ahead and answer the question. Even if you're not in a health system, if you are working with health systems and you get a sense of what your customers are doing out there, we're just trying to get a general feeling of what's going on. So we'll go to our next question, and then we will look back at the poll results. So let's go with Doug on this one. Do you have a structured approach to managing your inventory of IT assets, and how do you utilize that approach to identify potential cost savings? So Doug, answer this in terms of, you know, working with your clients at Encore.
Yeah, what I would say to the group is, you know, from an Encore perspective, we've developed a framework that, you know, as I mentioned before, is sustainable in the way you both inventory your assets, but also begin to measure and determine the value that those assets are creating. I think Chris has a good point. You know, it doesn't always result in, you know, reduction of cost, because there are, you know, I'll say foundational elements of IT that are going to be there regardless of, you know, their ultimate you know, sustained value to the organization. But you have to start, you know, I applaud Chris to know he's got more than 1,700 apps and, you know, solutions in his mix. You know, I would suggest that many people don't have that clarity. So it always starts with putting your arms around what's in that portfolio. Secondly, then it's how do you assign attributes or categorize that portfolio so you can begin making value judgments. You know what constituencies does an application or solution serve? You know, what's the operational output that it creates? You know, any number of attributes that allow you to begin to measure and compare your solutions, and then ultimately, as I said before, you know, you end up determining where they sit on the value continuum, and begin to make decisions. Sometimes hard decisions, sometimes political ones about where do you continue to invest and where do you de-invest in that process. But I think in order to be effective in this, you have to have a process that isn't just a one-time thing, that you're constantly evaluating, as I said, what's in the portfolio and what value it creates.
So basically, Doug, as a first step, you have to know what you have before you can rationalize anything. So you're saying plenty of people out there wouldn't even be able to give you a semi-accurate number of how many apps they have. Is that correct?
You know, I think that's true, and as I said before, I think the challenge is to not just think about it from an application standpoint. I think that's the way most people do, and it's a reasonable starting point, but you then have to relate those applications to any number of technologies that are related, whether that's data center technologies or end user devices and the like. And don't forget your workforce. It's a key asset that many people have invested in as they've taken their EHR journey. And I think Chris made a good point as he begins to term his organization IS. What does that mean from a workforce standpoint? And again, I think you're going to be faced with, where do I invest to create new capabilities in that workforce, and where do I de-invest because, certain skills are no longer needed.
Very good. All right, let's take a look at our poll results, and I'm going to share those with you now. And we can see that grow dramatically is 19%. Nobody's growing somewhat. Stay about the same 19%. Shrink somewhat 31%, and shrink dramatically 25%. So, Chris, if we look at those numbers, we've got certainly most people are either staying the same or shrinking, and only a few lucky folks are growing dramatically. What do you think of those results? Any thoughts?
It's not shocking. I think what we've gone through over the last decade is some of the transformation. I think it's time to, for a lot of reasons, I think the payer mix is one, as Julie mentioned, but I think for a lot of reasons it's time to deflect some of the capital outside of IT. We've been making IT investments for a while. If you don't mind, I'd like to get back on the prior question and respond to some of the things Doug mentioned. He was spot on. I think the piece of the portfolio that a lot of organizations forget about is the talent pool. And you can have as many applications and technologies you want, but if you don't have the right talent lined up, or if you have talent that hasn't been, adjusted to the new vision and the new direction, then you're in trouble as well. And what it causes you to do, and one of the initiatives we're working on now is we're completely retooling our portfolio team, and we feel that that's one, if not the most foundational attribute of a strong IS organization is to understand what you have. And the reason I know we have 1,700 is because I told them to stop counting at 1,700, so I'm sure there's more. But the reality of it is you have to, we knew what we had, but I can tell you we didn't manage it well. So I think we did portfolio accounting and not necessarily portfolio management. So over the next 12 to 18 months, we're going to put an aggressive push on changing the way we manage the portfolio, at the same time kind of right-sizing it. But talent is one of the critical components of that. And unfortunately, when we came up and looked at the portfolio and where we're going, there's some misalignment there, so it's causing us to make some major adjustments.
Yeah, and I think we do have a question on that down the road, but thank you for jumping in with that, Chris. Julie, let's go to you on the next question. You actually touched on governance. IT governance tends to be a focus ahead of and during large-scale IT projects. How are you utilizing governance to rationalize your IT asset portfolio and to find cost savings? Do you see an increase in reliance on governance to drive key rationalization decisions?
Yeah, we've, you know, Chris made a point about I think it's one thing to inventory everything that you have. The other, the challenging, maybe more challenging part in some organizations is to really manage the inventory and manage the portfolios. And so I feel like we've gotten our arms around the inventory and the plans to rationalize the applications that we have, and we do have a good governance process in place that really engages operational leaders in helping us prioritize what we do have. I think the challenge that we will face is that our governance process is really more about managing demand. So we get, you know, we get tons of requests on a weekly basis, and we leverage our governance process to help us prioritize. And we have a series of decision drivers that we walk through, and we have tools to help sort of, you know, create a list of our priorities. But what it doesn't support is how do we manage the things that we have today. And the challenge is the accountabilities for making those decisions, and they're tough decisions because everybody has their, you know, their little niche system, and oftentimes they put in, operations puts in new systems that we don't even know about, and they don't consider them to be IT systems, whether they're point of care devices, or, you know, they're a standalone, best of breed, you know, little application to solve a departmental problem. They don't think of it as being something that they need to help us manage and understand the inventory. They just, you know, they're out doing those things, and it's sometimes tricky for us to get our arms around those things. So once we do, we have to really advance our governance process to be less about managing demand and more about managing what we have in place today, because the inventory part is easier for us, although as it grows and people add those things I mentioned, it becomes an ongoing challenge. But we have to revise kind of our thinking to be more about managing what we have rather than looking at new projects or new requests.
You know, and Julie brings up a good point that you know, it's the things that these gray areas that cause us, you know, these surprises that she mentioned. You know, operations will make a decision, for example, but you know, you get the whole, you know, growth of the cloud approach where, you know, vendors come in and say, you don't need to contact IT because that's in the cloud, or a medical device that, you know, is it really a medical device, or is it, you know, even though it's wireless and it runs on your network and it's generating a boatload of data, is it a medical device, or, you know, should it be governed by IT? So I think we just have to accept that that's happening and then adjust accordingly. But I think the shift from demand management to portfolio management is extremely necessary.
Well, does it need to be stopped, Chris, in some fashion? I mean, a while ago I interviewed a CIO who said it was he was using sort of the procurement process to catch things that were being purchased outside of IT that should be going through IT. So there were, you know, I guess there could be many different ways that you try and prevent these IT-associated purchases that are happening outside IT. Because it doesn't matter how good your governance is if this thing skirts the governance, right?
Yeah, I think if you try to put the stops in there, that may be a failed approach, because what you really want to do is build business partnerships out there and have them, you know, see the value in the governance and participate in it and include us early and often versus putting these stopgaps downstream, because then you become the department of no instead of the department of yes if, you know, and using an yes if strategy means, you know, we can do that if we don't do something else, or we can do that if you follow these standards. And I think putting in those stopgaps, I don't know that works long term. Julie, I don't know how you feel about that.
Yeah, no, I agree. I think it's more about education and, you know, marketing the advantages of having us involved early. And we've taken the approach of, you know, we've got executive directors responsible for IS at each campus, and we really try to embed them in a lot of operational meetings and discussions where some of these things, ideas come up, and they can help move them forward and advance them, not necessarily say no, but so that we're aware and we can plan for these things, because they budget them at the local level, but they do require our shared centralized resources. So if we've got, you know, more visibility and more education to, and there's more advantage to operations to have us involved early, they're starting to understand that. So it's really been an education process.
Doug, let me ask you, you know, we pick any number you want for applications, and you want to reduce them by 500. And everybody's, you know, some of these were bought outside of the IT process, and everybody's got their favorite system, they're using it. At some point, we want to turn some of these things off. We want to get that number down by whatever it should be. Is one of the things you're helping clients with figuring out how to actually do that and not sort of alienate groups of people left and right? Because essentially you have to take toys away and either get them to use another toy, which may be part of the enterprise EMR suite, or something, right? Because ultimately we are talking about turning some things off.
Right. You know, ultimately that's absolutely the case. I'd point to two things. One, I think Chris made a very good point earlier when you're thinking about rationalizing your IT costs. It shouldn't be, I'll call it IT-centric. It really needs to be operationally led, and you need those business partners in order to make good decisions. I think any good governance structure is going to be reflective of that operational leadership. The second part is, you know, there is a set of, I don't know, I'll call it tasks that are part and parcel to the way you actually act upon, you know, decommissioning any system. You know, most of us will think of some of these, if not all of them, but you've got concerns about what you do with the data, its accessibility, you know, any legal ramifications that you have to apply in managing that data in a you know, archived or legacy state. You've got concerns about, you know, financial as well as legal issues to deal with, in, you know, potentially terminating contracts and, you know, depreciation and the like. You certainly have IT operational impacts, you know, whether you're taking things out of a data center that are related end user devices, as Chris I think mentioned, medical devices and the like. And then lastly, you've got end user concerns. You know, I think somebody mentioned, you know, that, you know, people have their personal preferences and would prefer not to let them go. You have to go manage that change, you know, with your end users, the way you communicate, the way you instruct them on, you know, future access and the like. So I think it's a combination. If there's an umbrella to the two of those, you know, much like putting an EHR in, it's a change management process, and you have to manage it in that context.
And Chris, isn't it true that all application users are not created equal? So you got to find out who's using this particular toy, or not toy, who's using this particular app that you may be wanting to turn off. Because if it's, you know, one of your high-powered surgeons or one of your best cancer care providers, you know, maybe we let he or she keep that tool.
Yeah, agreed. And I think if we are playing down at that level and not more at a strategic and institutional level, it's probably a no-win situation, because everybody's going to have a preference. But, you know, and I learned this from a lot of my buddies that I worked with over the years at Encore and in the past, is, you know, you got to create those guiding principles of what are you going to be doing for the institution. You know, and one of them that I've adopted and tried to instill every place I go is, you know, integration, meaning driving institutional standards, trumps preferences. And you got to help them understand that their preference, while it may be perfect for them, it doesn't fit into the bigger puzzle. And if you can keep the patient at the center, or your mission at the center, and talk people through, I don't mean off or out of, but through the decision process to say, let's make institutional decisions, then you're in a better place. But, you know, if you just go in there with a heavy hand and say, we're no longer going to be a mainframe shop, I'm turning your application off, that's not going to work. Or if you go in, especially with, you know, in an academic medical center, which, by the way, this is my first exposure to it, and boy, is that an adventure. But, you know, you go into an academic medical center and say, hey, you know, Dr. X, I know you're the smartest guy in the world when it comes to pancreatic cancer, but we're no longer going to support your application. Again, you're not going to win, and you're not going to also keep your job very long. So I think you have to be more collaborative and supportive and understanding and making sort of the institutional decisions. And they're smart people, and if you present the right case, it usually works out for the best.
Right. Right. Very good. All right, Julie, let's go with you on this. As you consider your IT cost structures and potential demand for driving IT cost savings, and I think Chris touched on this, how have you developed your workforce strategy to align to your management of your IT portfolio?
Yeah, we have a central IT function across all of our hospitals and clinics, but we're really trying to continue to we continue to have decentralized staff who support systems across the various campuses. And the challenge is as long as, you know, we continue to have as many local applications as we have, which is a large number. It's not as many as Chris mentioned. Hopefully, at least from what we know, we're in the 600 to 700 range. But a number of those, because we've had Epic in place for so long, it's really our core EMR, and many of our ancillary systems are Epic as well. We've reduced that number a lot. But those that exist out at the campuses have to be supported. So we do continue to have a decentralized team that supports that. So with the you know, more and more applications becoming cloud-based SaaS models, and where we're bringing more applications into the centralized realm, we're looking really to advance the development of our team centrally to support those shared applications. So we continue to see that shift from decentralized to the centralized model. We've also been advancing our PMO. We have an IS PMO, and we're not project managing everything for operations, but we have matured our IS PMO in the last couple of years, and we continue to advance and mature that such that we have dedicated portfolio managers, program managers, project managers, which is a sort of a tiering for how we're managing our applications that we haven't had in the past. So we're seeing that shift as well. But one of the things that Chris mentioned that sort of helps all of these applications out at the campuses that are decentralized is we have a process where when somebody in operations at a manager level or above wants to request a project, they submit a project exploration request. And in that request, in every request, we remind people of our IS guiding principles, which have held true for over 10 years, where we really try to drive people back to, you know, figure out why Epic wouldn't work first. You know, our core systems wouldn't work for maybe a niche problem that somebody is trying to solve. So we always, and in a lot of our governance meetings and our meetings where we're out educating operations, we remind people of those guiding principles. Chris mentioned that. I think it's an important point, and we tie it into everything we're doing from, you know, trying to centralize our applications and the staff that support that to responding to requests.
Chris, any more on workforce issues?
Yeah, everything Julie said is spot on, and you need to do the one thing that I've learned over the years is you got to look a little bit past the horizon. So, you know, as you transform the IT department and you become more of an institutional asset, you need to make sure that your team is in place, and it's not the skills necessarily. I mean, it's really extremely important that you have the skills to run the applications and the things in your portfolio, but it's do you have the right culture and team in place? So one of the things that we started last year here is what we call a talent calibration, and we look for certain traits as we move towards a service-based organization, and look at 12 or so identifiers and try to identify, is the team aligned right? This is not a performance eval, so it's not looking at your job description and say, how did you perform last year? But it's like, do you have the tools and the traits necessary to continue the IS transformation that's occurring now? So we look at, say things like financial acumen. You would think, why is that important to an IT function? Well, when you're trying to create an ROI or look at things from a capital versus operating expenses, it's nice to have those skills in some cases. Do you have domain expertise? Do you have strategic thinking, emotional intelligence, things like that? And then that allows us to look at our whole, again, they're part of the portfolio, but our assets, our talent as an asset, and make investments in the right areas. So if we notice that, for example, we need some additional focus in the financial area, well, we'll put a program together over a series of months to do sort of a Finance 101 course and just get people to have those traits necessary to continue this transformation. And it also allows you to invest back in people, so it helps your turnover and your retention process.
Doug, you have any thoughts on the workforce issue?
I brought up before, I think it's a key element when you consider your full portfolio of assets, and I think both Chris and Julie stated that very well. I do think it's about looking ahead to what talent and skills and, to Chris's point, culture you're trying to build in your organization, and to think of it somewhat pragmatically as you kind of set that future state, if you will, of what your talent needs to be in order to deliver the capabilities and service that you need. So I don't have much more to add than I've said before, but I think both Julie and Chris outlined pretty well, how you begin to think about that asset in the context of the total portfolio.
Very good. All right, we're going to go with our second poll now. So this is a check all that apply. Fat in my IT portfolio is due to a preferred vendor, political reasons, shadow IT personnel, IT assets owned outside of IT, lack of focus on application decommissioning and rationalization, or other. So check off all that apply, and if you would submit your answers, we would really appreciate it, and we will discuss that in a moment.
Wouldn't it be easier to just put a G, all of the above?
Yeah, right. That's what we may see. That's what we may see. So, well, let's get people clicking. It's good exercise. Chris, let's stick with you since you wanted to chime in there, buddy. Do you expect further IT capital spending? If so, in what areas are you likely to increase spending?
Yeah, we just completed our EPIC transformation in March of this year. So we'll probably put at least a couple cycles of optimization out there, which will require some capital dollars and capital investments. Probably the two other areas that we'll continue to put dollars into will be on the security side. With the amount of research we do, we're going to continue to invest heavily on the research, on the security aspects. And then in big data, one of our goals here is to, our president talks about research-driven clinical care. Historically, research is done sort of in one silo and clinical care is done in the other. Here, we're trying to bring those two together. So you'll see a lot more investment in the big data areas, which means how do we take the research information, research knowledge we have and put it closer to the point of care as possible, and vice versa. How do we notify or identify patients that might benefit from some of our research? So how do we integrate that tighter? And we'll probably put a lot more emphasis on the big data, cognitive computing aspects of things. So those areas in particular.
Julie?
Yeah, our capital spending is definitely likely to go down. Where we're continue to decrease, where we will continue to spend money is in the areas of ACO and population health, probably most significantly. We just signed our first direct-to-employer contract with Boeing to provide care for more than 35,000 Boeing employees and their members of their family. So that's driving a lot of of our spending, and it's really more of a population health model. So it's a lot of the tools that we need to put in place and the processes operationally to support that. We have the same challenges around security, so we're continue to spend money there. We also have a big optimization push in the last couple of years to drive standardization. We implemented Epic in particular. We're optimizing now. We implemented it, more than 10 years ago. So there's a lot of new, more efficient ways to do things and ways to drive more standardization, which we think will take costs out eventually. And then we have a big data center move as well, which has been underway for a couple of years, so we can't really slow down our spending on that. It's a commitment we made a couple of years ago, and we've got to modernize our data center. So those are probably our big areas. And when I talk about population health, there's a lot of the analytics components that support that, so we've been investing in a lot of those tools as well. So it's kind of a big category with a lot of capital spend associated.
Yeah, it's a lot of folks with Boeing, right? 35,000, big company. All right, we're going to look at the poll results, and Doug, if you want to take a look at these, I would appreciate it, and let us know your thoughts. So, preferred vendor, 29%, political reasons, 71%, shadow IT personnel, 43%, IT assets owned outside of IT, 64%. Lack of focus on application decommissioning and rationalization, 79%. That's our high. So if we want to look at ones that are over 50%, you've got political reasons at 71, IT assets owned outside of IT at 64, and a lack of focus on application decommissioning at 79. So what are your thoughts on those results, Doug? Is that kind of what you expected?
Yeah, it is. When you look at lack of focus, that's actually what we're talking about today, is how do you get that focus, and what kind of framework do you use to do it. So I had anticipated that would be high, and may even be higher than I thought, but I think it's a reflection of the dialogue today. When we look at political reasons, I think both Julie and Chris, and even my own experience as a CIO, there are all those, challenges you have with either long-time or critical leaders in the organization, especially positions that you have to go address. And we all know healthcare is a highly political environment, so not a surprise there. And we've all dealt with the shadow IT, if you will, that has existed, not from a personnel standpoint, although that's on the list, but individual purchases going on. I think Chris pointed to it well in terms of how do you begin to try to put your arms around that and have it be a more strategic decision. But when I first stepped into my CIO role, that was the normal course. Every leader, every department went out, selected their own thing, and it was up to IT to respond to that and go implement it. So not too much surprise, and given our topic, it's good to see E at the top of the list.
I think if the other thing is, if you look at the way we're wired as IT professionals, and now I'll put my IT hat back on, is we're not wired to turn things off. We're just wired to keep things running and the lights on and have the blinky lights.
Very good. We're just going to go with some final thoughts, advice, or lessons learned. Julie, you want to offer up any advice to your colleagues before we go?
Well, I wish I could say that we have it all figured out, but this is an area that's definitely a challenge for us, and we're still really plugging away at it. I think what we're trying to do here is to keep it at the forefront, keep looking at bringing in new applications, and then a process to manage the applications that we have, keep it on people's mind, educate folks about what it means to plug something new into the system, and understand the value and the goal of rationalizing applications as we whittle away at it.
Very good. Chris?
Yeah, I think the best advice I would encourage everyone to consider is stay out front of this. Don't be a passive participant in the institution, be active. Because if not, if you're passive, it's just going to roll back on you anyway. So get out there and participate in the decisions. And it may not be, a seat at the executive table in particular, but how do you influence people to make the right decisions that come back for the institution? And then always look in the mirror. Are we doing the right things? Are we pushing the right buttons? Are we hunkering down on this decision for the right reasons? Just to make sure that we keep the patient and the provider's perspective and the institutional mission in mind.
And Doug, we'll give you the last word.
Sure. I think Julie and Chris make some good points. I think we as IT professionals, while there's times where you have to shoot from the hip, we all know if we want to get good at something, we need a repeatable and sustainable approach and framework. And to Chris's point, if you want to get out in front of it, you need to put that in place and exercise it. It's not a one-time thing. It's something you have to come back to over and over again. You've got to integrate it into the way you execute your governance and your decision-making. I think both Julie and Chris said you got to be governed by guiding principles, which are the most objective way to try to drive decision-making in your organization. But ultimately, it's got to be a process that you can sustain and that you are constantly revisiting in order to make sound and cogent decisions.
Very good. All right. Well, that's about all we had time for today. When you close your WebEx window, you'll be taken to a post-event survey. If you could take a moment and answer those questions, we'd appreciate it. I want to thank our panel, Chris Belmont, Julie Morrison, and Doug Abel, and a big thanks to our sponsor, Encore, a Quintiles company. You receive an email when our archive recording has been posted to our YouTube channel. For those of you who hold the CHIME CHCIO certification and attending our webinars, it gets you 1 CEU. So if you let CHIME know you were here, and if you've asked us to do so, we certainly will. To produce a webinar panel on a discussion of your choice, please contact Nancy Wilcox, and we put that together for you. The final slide in this deck you can use as a certificate of attendance if you need CEUs towards another program, and you can go to our website to see our upcoming schedule of events. So once again, I want to thank Chris, Julie, Doug, Encore, and our audience. Everybody have a wonderful day. Thank you.
Thanks.
Take care.